If you are on methotrexate or about to start methotrexate, you deserve the truth about the side effects. Not the sugar-coated version, not the horror stories from the internet, the actual evidence-based truth. I'm a rheumatologist. I prescribe methotrexate every day. And today, I'm sharing you 5 truths about methotrexate side effects. And every patient needs to hear about those important side effects. Some of these will reassure you, some might surprise you, but all of them will help you take the medication safely and confidently. If you are new to our channel, welcome to the Rheum Doc. This channel has one mission: to help you live better with rheumatoid arthritis, with less pain, more mobility, and long-lasting joy in your life. There's a lot of misinformation out there about rheumatoid arthritis and the medications. If you go to social media, if you go to YouTube, you will see a lot of misinformation. This channel exists to fight that misinformation with real science explained and simple language explanation so that you can take the best decision for your health. Every video that we create gives you practical, evidence-based tips you can use today. So if that sounds like something you needed, hit that subscribe button and join the community. Before I go further, a quick question. Are you currently on methotrexate? Drop a yes in the comments and tell me your experience. Now let's go to those 5 important truths about methotrexate. Before we dive in, let me give you the roadmap and I'll summarize those 5 important truths that we'll be covering today. The truth number 1. Most side effects are mild and fixable. I'm going to show you the actual data, and it is far more reassuring than what you have read online. The truth number 2, the methotrexate hangover is real, but it is temporary, and there are some simple ways to plan around it. Number 3, your liver test monitoring is for prevention, not to panic you. I will explain why the fear around liver damage has been dramatically overestimated. And the truth number 4, infection risk is small, actually smaller than prednisone and most other biologics. That one catches a lot of people off guard. Truth number 5, this is the one nobody talks about. Methotrexate may actually save your life. We are talking a 41% reduction in mortality. That is not a small number. So let's get to number 1. So let's start with the truth number 1. Most side effects are mild and fixable. Yes, side effects happen, but the vast majority are mild and manageable. When I look at this particular side effects, I did some deep digging into the literature, and there was a study which looked at 20,000 RA patients, and they found that up to 24% experience nausea. That means 76% of you who are taking methotrexate, you will not have nausea. While 20% report abdominal pain, 80% had some stomach pain, but ultimately, only 8.5% had to stop the medication. Now here is a key fact. Side effects are fixable. If you do experience nausea or stomach upset, there is a proven strategy before giving up on methotrexate. That is taking your folic acid. Now let's go to the truth number 2. The methotrexate hangover is real, but it is temporary. Let's talk about something your doctor, your rheumatologist may not have warned you about: the methotrexate hangover. Many patients describe feeling tired, foggy, or slightly off to 1 to 2 days after taking methotrexate, your weekly dose. When you read about the package insert, it will list fatigue, malaise, and dizziness as commonly reported side effects. Some patients also report difficulty concentrating and mood changes. I'm not going to tell you that this does not happen. It does. And to some of our patients, it could be harder to tolerate. But here is what you need to know. The pattern is predictable. Day 1 is when you take a methotrexate. Day 2 to day 3 is when you feel that fatigue, the fogginess, and the mild nausea. But by the day 4 through day 7, you feel normal again. And I have a practical tool that you can use. You can plan around it. And here is my strategy. Take methotrexate on a day when you can rest the next day. Either Friday evening is a popular one for many of my patients, so that you have time to recover over the weekend. You stay well hydrated when you are taking methotrexate. Increase your folic acid. You can ask your doctor about how much methotrexate you are taking and how much folic acid you need to take. If fatigue is severe, switching to subcutaneous injection might sometimes help you. But remember, the hangover usually improves over time as your body adjusts to the new dose of methotrexate. But here's something important to consider. RA itself causes crushing fatigue. Many patients find that once methotrexate controls the disease, their overall energy actually improves, even with mild hangover days with methotrexate. Trading one tired day for 6 good days is a good trade most patients are willing to make. That's why listen to your body and also communicate to your doctors if in case it becomes more severe that you are not able to manage. Now, the truth number 3 is your liver needs monitoring, not a panic attack. This is the truth that requires nuance. Methotrexate can affect your liver, that is real, but the risk has been dramatically overestimated. What actually happens is about 15% of the patient experience mild temporary liver enzyme elevation. This usually resolves in its own or with the dose adjustment of your methotrexate or the folic acid. Only around 4% of the patient need to stop methotrexate permanently due to liver issues. And the most dreaded complication, the significant fibrosis or cirrhosis, is very rare when we closely monitor. If you have a healthy liver and no major risk factors, methotrexate is very unlikely to cause significant liver damage. Your action steps are simple. Never skip your blood test, limit alcohol use, maintain a healthy weight, and tell your doctor if you have diabetes or history of liver problems, even before you go on methotrexate. Now, the truth number 4, infection risk is small, smaller than what you think. This is the truth that got amplified during COVID-19 infection. But let me give you the honest picture. When we look at the bigger studies, I found a big study looking at 12 clinical trials looking at the risk of methotrexate. And that study found that there is a 25% increased risk of overall infection in rheumatoid arthritis. Most common things like cold, bronchitis, or upper respiratory tract infection. But there was no increased risk of serious infection. That's why methotrexate is actually one of the safest options from an infection standpoint. However, rare serious infection can happen. Your protection plan is to get vaccinated, wash your hand regularly, and call your doctor if you develop any fever. And never stop your methotrexate on your own without talking with your doctor first. They will help you guide when to stop and when not to stop your methotrexate. Now, the truth number 5, methotrexate may actually save your life. This is one of the truths that you may not have heard in the internet. While everyone focuses on the risk, they miss the biggest truth of all. Methotrexate reduces your risk of dying. Now, you might ask how methotrexate could increase your longevity. It primarily through cardiovascular protection. Rheumatoid arthritis patients have a significantly higher risk of having heart attacks and stroke because of that chronic inflammation that damages your blood vessels. Multiple studies have shown that methotrexate reduces those cardiovascular risks by almost 18 to 28%. This is the truth that should be in every online discussion about methotrexate. But instead, the internet is full of fear about the side effects, while ignoring the fact that this medication may literally save your life if you have rheumatoid arthritis. Now, let me also weigh the benefit and the risk. When you weigh the risk against the benefit, the picture is very clear. The risks of methotrexate are manageable: mild nausea, monitoring the liver enzyme elevation, and slight increased risk of infection. But the benefits are life-changing: controlled joint inflammation, preventing long-term joint damage, and a 41% reduction in overall mortality, and a 24% overall decrease in heart attack risk and strokes. Now, we need to be honest. No medication is free of side effects, but untreated rheumatoid arthritis is far more dangerous than methotrexate itself. Uncontrolled inflammation destroys your joint, damages your heart, and shorten your lifespan. Now let me summarize what we talked today. Your 5 truth action checklist. Truth number 1, side effects are mild and fixable. By taking your folic acid daily and try the proven fixate that we have discussed, we can minimize those side effects. Number 2, the hangover of methotrexate is real but manageable. Plan your doses on a rest day and stay hydrated. Truth number 3, your liver need to be monitored closely but not the panic. Keep your blood test appointment and maintain a healthy weight. That could minimize this side effect. Number 4, infection risk is small but real. Stay current on your vaccines and call your doctor if you have any concern of infection. And number 5, methotrexate may save your life. Don't stop it without talking to your rheumatologist. Here is what I want you to remember. The truth about methotrexate isn't scary. It is empowering. Yes, side effects exist, but they are mostly mild, mostly fixable, and mostly manageable with the right strategies. And the benefit? Protecting your joint, your heart, and your life. You now know more about methotrexate side effects than most patients ever will. Use that knowledge. Take your folic acid, keep your blood test appointment, and don't let fear rob you from a medication that could transform your life despite rheumatoid arthritis. And remember, what we stand here at the Rheum Doc is less pain, more mobility, and long-lasting joy in your life, despite your diagnosis of rheumatoid arthritis. That is not just a slogan, that is a promise. Let me leave you with this question. What truth surprised you the most today? Drop in the comment below and share this video with someone who needs to hear the real story about methotrexate. And I'll see you in the next video. Bye-bye.